Good afternoon and hello everyone. Welcome to today's event, Ask Me Anything, Stay Sharp, Microplanning for the Flu and COVID-19 webinar series, sponsored by the National Association of Community Health Centers. My name is Elizabeth Breidenbach. I'm a meeting and event specialist based in the Clinical Affairs Division here at NAC, and I'm pleased to bring this event with my division colleague, Sarah Price, Deputy Director of Public Health Integration. Before we get started, I would like to review a few housekeeping announcements. You have joined this online event by either physically calling in or using computer audio. All attendee lines have been automatically muted and will be muted for the duration of this event. The duration of this live event is approximately 30 minutes, including introductions and, of course, a live Q&A. Again, the duration of this event is approximately 30 minutes, including introductions and a live Q&A. During today's session, we have taken questions in advance during your registration. Thank you so much for that. But again, throughout today's session, just like the title states, Ask Me Anything, the Q&A box is located in the lower right-hand side of your computer screen. Simply type your question into this box at any time. Make sure you submit to all panelists and ensure that you hit the send button. That is the only way we're going to get your information. So please type any comments, questions, or concerns. You might hear us link to some resources, and you might say, hey, can I get the link to that resource? Please use that Q&A box, again, located in the lower right-hand side of your computer screen, will be open for the duration of this event. Friendly reminders that today's event is being recorded and will be available on the NAC COVID website. All attendee lines have been muted and will be muted for the duration of this event. Q&A box is open for the duration of this event. Type any comments, questions, or concerns right here. If we cannot answer your questions in the time allotted, or we need additional time to look up some resources, we will either post this in our FAQ document or reach out to you individually. And last but not least, you'll be presented with a 4-question survey at the end of this event. This lets us know how we did, how valuable this event was to you, and directly informs us of future training and technical assistance. We value your feedback and encourage you to complete this survey. At this time, I'm going to turn things over to Sarah, who will be introducing today's speaker and then setting the stage for us. Sarah, it's all you.
Thank you, Liz. Good morning and good afternoon to everyone out there. My name is Sarah Price. I'm also housed in the Clinical Affairs Division at NAC, and I'm so pleased to be able to facilitate this session today. I'm a community health nurse myself, and so I really acknowledge and appreciate all the work that everyone else is doing out there regarding all things immunization. I am there with you. My heart is with you. So I really, again, just want to start by appreciating all the hard work that's going on, obviously around immunizations, because that's the hot topic and what we're talking about today, but also all the strong work that you all continue to do. We are so pleased, again, to be able to offer this Q&A session today. We have the wonderful opportunity of having Claire Hannan with us again. Claire Hannan is the Executive Director at the Association of Immunization Managers, and really has her fingers on the pulse of all things going on with both the flu vaccine as well as COVID-19 vaccine, and really all vaccines. Rather, obviously, these are her 2 main areas of focus. And so I'm going to turn it over to her to kind of set the scene for us today. We all know it's a moving target, Claire, and we know it's staying sharp is the only thing we can do, so we look forward to just hearing a few words from you. And then we will open it up for questions. Please feel free at any time, attendees, to go ahead and start putting in questions in the box. That helps us to be able to kind of triage through and prioritize what we can answer today in the limited time we have. And so, Claire, over to you.
All right. Thanks so much, Sarah. It's really great to be with you guys again. I have a couple of slides to kind of level set where we are. And wow, what a difference a week makes. We are in an amazingly different place this Friday than we were last Friday because we are actually vaccinating. So it's so exciting. Just a few things to talk about where we are. So the Pfizer vaccine did get authorized and recommended by ACIP. 636 sites received vaccine this past week, this week that we're in. And many of them began vaccinating, so I'm sure you saw the coverage for that. The vaccine supply is still limited, so, we really need to understand that. I know people are very anxious to get vaccine in some cases, but it is very limited. The focus of this early vaccination is on healthcare workers and long-term care facilities. 3 million Pfizer doses were allocated in the first week. All right, another 2 million coming this week, and then 5.9 million of Moderna doses expected for this week too. So that's about 9 million doses that have been allocated. That's at least, what we're hearing. And some of those doses are being put into the long-term care facility program. Many of those doses going to healthcare workers. But I will say jurisdictions are receiving lower doses than they expected. So some of the estimates that they were given for planning purposes were higher than the actual allocation they received. That's getting a lot of media attention. But I think we just need to focus on there are doses, they are being sent out to hospitals. They will be going to long-term care facilities next week. And so this program is rolling. Next slide. So some of the things that we learned. The shipping of the vaccine and the ancillary supplies really seemed to work. They arrived on time, on the same day. In some cases, they arrived a little early. So, there were some instances where the DDL was turned off before the package was actually received. But other than that, really good experience with the shipping and the receiving of the vaccine. The healthcare worker demand has been high. We've seen a lot of footage of healthcare workers getting the vaccine, getting excited about the vaccine, talking about why they're getting vaccinated, really good coverage. Some of the things that we're seeing, there is some misinformation circulating. We've heard some concern among healthcare workers about misinformation circulating saying the vaccine can cause sterility. We did collect some responses to that we can share with you all. If you all are hearing that myth, we can share that. Another thing that we're seeing is that the vials, which are multi-dose vials and have 5 doses in them, are actually overfilled, and they're producing 6 doses. So this is not uncommon to have multi-dose vials be overfilled. It is something of a bonus gift that we're receiving this 6th dose, but it does cause some challenges around tracking. We're actually vaccinating someone with a dose that doesn't exist on paper. So we're going to be working through those challenges in the coming week on how to track that, how to match inventory, versus your doses administered when you're administering that extra dose. Again, just this confusion around the allocation process, hearing different things about what states were told and what they actually received. Pfizer saying, they're producing vaccine, Moderna, the same thing. So I think what's going to happen, what we hope we'll see in the next couple of weeks is really a more regular, stable, predictable allocation, and we can sort of get into a groove of getting the allocation, sending in orders, and having those orders go out. So still a lot of stress and anxiety about phase 1B and 1C, who's coming next after healthcare workers and long-term care facilities. The ACIP is going to meet this Sunday and talk about that. A lot of stakeholders are weighing in. We're getting reports from our immunization programs that they're getting upwards of 30 or 40 emails a day from stakeholders, from the governor's office. A lot of questions, a lot of folks talking about, we're essential. Please make sure you're aware of us. We did hear that some states, some governors have said they really want to focus on reducing death and hospitalization. So they may be focusing on the 65 plus or those with underlying conditions. So I think what we can expect for the coming week is more hospitals getting initial doses of Pfizer, more hospitals getting Moderna vaccine. And so looking to see what that experience is like. And also long-term care facility programs starting next week. CVS and Walgreens going into long-term care facilities in many states and starting to vaccinate. So that's really exciting. So I think I will stop there and, we can just hit the questions.
Awesome. Thank you, Claire. And we so appreciate you kind of keeping your finger on the pulse and your eyes and your ears open for all that's going on. I think already some of the things you said answered some of the questions that we got previously, which was great. I want to start, one question that came up, and I think we've addressed it on every webinar, but the question's still out there, so clearly we need more information, is can you share with us, again, the process for an entity becoming a COVID-19 vaccine provider? Can they still do it? Is there still time? And what's the best route to do that?
Yes, you can still enroll as a provider. I mean, I don't think that any states have actually closed enrollment. I'm not aware of that in any case. You need to go onto the state public health website. You can look under the immunization program website and look for provider enrollment. There is a 7-page enrollment form. It asks about, you make a commitment, to adhere to the requirements and the policies and the guidance. You provide information about your storage and handling capacity and your patient population, and you provide information on your licensed providers. There is definitely, I don't want to say a backlog, but it is taking longer than we anticipated, I think, at the state level to enroll providers. And so some of you may have filled this out or completed the paperwork and haven't heard back. Hopefully with more resources coming, the states will really get moving and be able to enroll all of the providers who want to enroll. If you have not seen that paperwork, if you have not been able to find that, we can send you, I will send you, Sarah, after this call, a contact list for our members, which we have been working to update, and we finally, we have that updated, so you can reach out to the immunization program directly. You can copy me if you would like, so that I can make sure that you get the help you need, and we can get the enrollment information for you so that you can enroll.
Thank you so much, Claire. We've gotten a couple questions on that already. So it's clear, I think, people are really interested in signing up, and I appreciate that. One question that we got is about how the state offices of rural health, how can they support health centers in their vaccine efforts? Or, what are kind of these other entities that may not be community health centers themselves, but support community health centers? What are some ways that they can get involved to kind of help this process along?
I think we need all stakeholders, sort of on board communicating the messaging. So, again, I would, if you're that state rural health office and you don't have direct communication or partnership with the immunization program, it's time that we get that started so that you can have that messaging to send out, and we can make those connections happen. But I think that answering questions, getting the message out about the vaccine. At this point, most states don't have anything set up yet about their doses administered or where to get vaccines. I think that's going to come when we get more supply. But just knowing where to look for that, what is the message I need to be getting out, and then just getting messages out about the safety and efficacy of the vaccine. There have been a number of materials produced by CDC. Pfizer has a website, and now Moderna will also have a website that will go live. I will get you those links too. Sarah, Moderna has a training that will become available. Pfizer has a training that is already available. We can get you those links. Go on there, take those trainings, look at those videos, find out all you can about the vaccine so that you can share really factual and valuable information about the vaccine.
Excellent. Thank you so much, Claire. I want to move a little to something that you kind of mentioned previously, and we talked about in other calls, which is the hesitancy factor. We know that there's a lot of information swirling and about both side effects and efficacy. Are there any kind of key messages that everyone on this call should kind of have at the tip of their tongue about the safety or how safety is being tracked for these new vaccines since they are new in our world?
Sure. Well, I think it's always important to listen. First of all, listen to whoever is expressing the concern. It's very important to understand and express that empathy that obviously there's reason to be, concerned about a new vaccine. Listen first. And then some of the things that are common are that, this has been developed too fast. And I think you can get good messaging on that. There really has not been any corners cut on safety and efficacy. While the vaccine has been developed more quickly than a routine vaccine, it's because that an existing vaccine research platform was used, and phase 1 and phase 2 trials were combined. Phase 3 trials occurred simultaneously to production, and we were able to do that because the government funded that production. So companies with stockholders didn't have to wait until knowing that their product would be safe and effective before they could produce it. So there have been things done to speed the process. Yes, that's true, but safety and efficacy have not been diminished at all. And the phase 3 trials were as robust as we've seen with any other new vaccine. And the data have been pored over by 2 independent committees. So this process, this tried and true process that FDA uses, is being now used for Moderna. So that is very reassuring. There are some myths floating around. I mentioned one of them. I can get you some information on that to Sarah. There's another. You may hear another question of, well, will I test positive? Can I get the virus from the vaccine? You cannot. You will not test positive after getting the vaccine for the virus because there is no live virus in the vaccine. It's encoded messenger RNA that is instructing your body to produce a protein-like piece that resembles the coronavirus, but it's not live virus, so you cannot get that from the vaccine. As we hear of other myths, we can send information to you, but it's also important to emphasize that vaccine safety is something that we take very seriously. And anytime a new vaccine is put onto the market, but especially with this one, there is continuous monitoring and tracking through multiple systems to make sure that the vaccine is safe and any adverse events are investigated, tracked. We have a new vSafe. In addition to the VAERS reporting system, in addition to the CISA, the safety data link, in addition to looking at claims data for those who have been vaccinated, are they getting hospitalized or going to doctors more frequently than those who haven't been vaccinated? In addition to that kind of tracking, we have this actual vSafe where people that are getting the vaccine enroll and they're receiving text daily. And they're replying to the text daily about how they're feeling, what's happening with them, and so that we can track and monitor everyone that's getting vaccinated. So that's really important. You probably saw that there was an allergic reaction in a healthcare worker in Alaska that experienced the anaphylaxis, and that also occurred in England. So because of that, we are being very vigilant. There is guidance that when you give the vaccine, you have, you're able to address if anyone should have an allergic reaction. And also it's critically important to monitor for 15 or 30 minutes those who have been vaccinated. This is happening. CDC is, looking into the anaphylaxis. We should have more information on how to screen for allergic reactions as we get it. But basically what we know, and, we don't know everything, but what we do know about the vaccine is that the vaccine trials, the data is very strong on showing the safety and effectiveness of the vaccine. And we're monitoring it very, very closely moving forward.
Thank you. I know I said better already.
Sorry about that.
No, that's fine. Thank you. And again, one of our purposes of having this webinar is exactly to be able to address some of those myths and point you all in the right direction on that, and we'll continue to do that. One of the questions, and again, I think it's again front of mind because right now staff are kind of the first people who are being vaccinated. So there's a lot of questions about, and this came up I think last week as well, about staggering staff vaccination, what to do. Do you need to also have high priority staff within the staff that have to be vaccinated, and how are those choices made? Do you have any guidance that you either have or can point to us about, maybe some best practices that we've already seen in just this first week about staff vaccination?
So some states have put out some guidance around who within the healthcare community should be prioritized. I think most are leaving that to the hospitals to decide how to stagger their employees and who should be vaccinated first. The ACIP did put out some guidance. I would refer you directly to their presentation, but I can read to you what it says. Sub-prioritization guidance of healthcare personnel should be considered. Individuals with direct patient contact who are unable to telework, personnel who provide services to patients or patients' family members, personnel who handle infectious materials. This can include inpatient or outpatient settings, as well as persons in residential care or long-term care facilities. And then personnel without known infection in the prior 90 days. So you're really looking to vaccinate those who have direct contact with COVID or COVID patients, and those who have not been infected with COVID in the last 90 days. Those would be your primary targets first.
Great, perfect. That's a great place to start. We have a few minutes. We've addressed most of the questions, but I don't want to forget about flu. This is Ask Me Anything about both flu and COVID, and so far we've only talked about COVID. So, Claire, I just wanted to talk a little bit about the importance of getting a flu vaccine, the importance of still messaging about flu vaccines so that's not lost, and maybe some key strategies to ensure that the importance of the flu vaccine isn't lost in the world.
We need to continue to beat the drum for flu vaccine. It's so important, especially now when hospitals and healthcare systems are getting overwhelmed with COVID. The last thing that you want is to have flu symptoms where you need to go to a hospital and you're surrounded by COVID. And we don't want that on our healthcare system either. So, it's really important to continue to emphasize it's not too late to get vaccinated. There is vaccine available. You can get vaccine at many, many locations. You can check Vaccine Finder, pharmacies. As you all know, the community health centers have a late season vaccine that, you want to get out into the community. Hopefully that the social messaging, the communication on flu. I've seen a lot of campaigns. I've seen a lot of communication. Hopefully that continues through December into January. Most years we don't see actual flu really getting to the outbreak level in states until February. So it's definitely not too late to really push out to your communities, get the vaccine, get vaccinated, make sure you're protected against flu, for sure.
Excellent. And one point I think Claire and I always like to stress is, if you're at a health center and you've run out of flu and you're running out of flu, talk to your jurisdiction immunization manager about that. Contact your public health department about that. I think, we've heard a couple of those stories this week about, low flu stock at health centers, and I think the worst thing to happen is anyone run out of flu when someone wants it. So definitely keep that conversation just as you're conversing with your immunization manager around COVID. Continue that conversation around flu.
That's a really good point. And I know Sarah and Kathy had reached out to me to just wondering how many doses of those were used. We did reach out to CDC, so we hope to find that out. But immunization programs can swap doses with each other. It's fairly easy to do, even though everyone's swamped right now with COVID, if there's a need to get flu vaccine doses and we can help identify another state that might have doses, we're really happy to do that. And vaccine doses can be swapped. We don't want, like Sarah said, we don't want these doses to go unused.
Perfect. So, keep the conversation going at your health centers and in your communities around flu. It's more important than ever. It's always important every year, but really, really important this year. That is all the questions we have right now. We do have a few minutes, so I want to close with just a few announcements from the next side. But if you have continuing questions, we have a few minutes, so please feel free to share in the chat. Before I go to announcements, Claire, do you have anything else to add or any bookends for us this afternoon as we end the session?
I guess I would say that if we hear these challenges, some of these myths we're hearing, I just go back to what's happening. And at the end of the day, vaccine is going into arms, and how great and exciting this is. So every day that someone gets vaccinated is a win. And the vaccine continues to be in limited supply. So, I know that's frustrating, not knowing, when you're going to get it. The allocation system will obviously work the kinks out of that. But just keeping in mind, every day someone's getting vaccinated, and now we're going to have Moderna vaccine coming into the market. So this should really help boost us and get us moving down this track of getting everyone vaccinated.
Perfect, Claire. We actually had one extra question slide in, so I'm going to ask it. Can a person take the flu and COVID vaccine at the same time with the information that we know?
So that was not studied during the trials. Both Pfizer and Moderna have said, and well, I should say that ACIP has discussed this, and I think it's a 7 or 14-day window they recommend that if you get the flu vaccine to wait. And I think that's not really out of safety concern. It's more out of concern for tracking what's going on once you get the COVID vaccine. And we don't want to have anything, sort of interfering with that. So get the vaccine, the flu vaccine 14 days before you get the COVID vaccine or 14 days after. But that's what ACIP, I think, is stating. We should get more guidance on that, and I can get that to you, Sarah. Go get the flu vaccine now.
That's what I keep saying. Thanks, Claire. Perfect. And we had one other question that came in about the same topic, so hopefully we address that. I want to close out our time today just reminding you that this is still a series. We are skipping the next 2 weeks for the holidays, so our next Ask Me Anything session will be on January 8th from 12 to 12:30. It'll be interesting because that's several weeks away, so we'll see how much has happened since then. I'm sure we'll have a lot to update you. If you haven't registered for all the sessions, go ahead. You can do that now. You can also, there's a QR code there you can swipe with your phone if you'd like. Also, I wanted to let you know that these sessions and also an FAQ document that we're currently working on is going to be posted at NAC.com on the COVID-19 page. So all the information is there. As you know, making any kind of FAQ document during this very, very quickly moving target can be difficult. So your patience with us on that one. Sometimes information gets outdated as quickly as it's posted. So, but we'll try to at least, keep consistent resources and all that for you as well. Next slide. Maybe that was the last slide. I think so. Perfect. Well, we are out of time. Thank you all so much again for joining us today. Claire, thank you so much again for joining us and being open to us asking you anything. We wish everybody happy and especially healthy holidays. Again, we just thank you for all that you are doing out there. If there are any, other questions or resources that you all feel you need, feel free to reach out to NAC and we're happy to triage those questions for you and get you the answer. Some of you asked questions that we need to do a little research on, so we'll be getting back to you on those as well. Thank you again to Claire. Everybody have a wonderful next couple weeks and holidays. Thanks.
Thanks so much, Sarah.
Thank you, Claire and team.